Good afternoon. Welcome to this week's briefing from the St. Louis Metropolitan Pandemic Task Force. Today we'll once again review the current data, and then we'll take care of a few questions that have come in surrounding the vaccine approvals for different purposes, the use of vaccine in kids, and booster recommendations. So jumping right into the information, this is the epi curve for the St. Louis region. Again, the green bars show the number of cases reported on a particular day. That tends to be a little bit lumpy with reporting variations, so we smooth it out with the 7-day rolling average. At the far right, it's pretty easy to tell that we are seeing a clear decline in the number of cases in the region. Not huge, but it is definitely coming down, something that we're all happy to see. Likewise, the number of new admissions to hospital are down. Our 7-day moving average is down by about a third from this most recent peak at 55, and we only had 31 new admissions yesterday, which is certainly on the low end of things. And as would be expected, our census is also coming down. So at 354, this number is also down a little more than a third from the peak we experienced with this most current wave. There are now 110 patients in ICU, 76 of whom are ventilated, but it's safe to say that the health system capacity is in relatively good shape concerning taking care of COVID patients. Hospitals are still quite full, I think taking care of a lot of pent-up medical needs that weren't able to be addressed during previous months. Last week we administered 421 monoclonal antibody infusions in the region. As a reminder, you could think of this being about a 10-to-1 payback. So for about every 10 infusions, we avoid a hospitalization, which is really remains the most effective prevention strategy we have once people have been infected. It's still not a substitute for vaccination, however. Currently, there are about 14 kids in hospital in the 2 children's hospitals, 4 of whom are in ICU. Again, this number is down some from the peak. And yesterday we discharged 65 patients, bringing the total number to over 28,600. So again, a lot of care having been delivered to COVID patients during the last year and a half. In terms of the road ahead, once again, our mathematical models predict that we'll continue on this downward trend. As a reminder, the individual black dots are the number of patients in hospital in one of the 4 health system hospitals in St. Louis, and the lines represent the best guess, which is the middle line, and this sort of upper and lower estimates. And currently our inpatient census is tracking along the model predicted for our best guess of a couple of weeks back. Vaccination rates continue to creep up. It's slower than we would like, but we are getting close to having 50% of the St. Louis metropolitan area fully vaccinated, and about nearly 55% have at least initiated the series. This still lags behind the national average. And I know there are still questions about should people worry about getting vaccinated with rates coming down. I think the bottom line is one of the most compelling reasons to do so is on this slide. With vaccination rates that are about 50%, we would expect that in the hospital, if vaccinations made no difference, we'd see about the same number of patients with and without vaccinations. That's definitely not what we see. 80% of hospitalized cases are unvaccinated, and of those 20% who have been vaccinated, most of them have some underlying predisposition that makes it harder for them to handle COVID. So there's plenty of evidence on this slide for why vaccinations help. I will also mention that for that 20% who wind up in the hospital despite being vaccinated, if a larger proportion of the population was vaccinated, they might not be exposed. And so some of those hospitalizations likely wouldn't occur either. For the questions today, first one is, with numbers improving, why is there still such an emphasis on vaccine? That's, I think I've already answered. The number one reason is that it protects individuals from potentially serious illness that could lead to hospitalization and even death. And even if people don't die or get hospitalized, there are many individuals who are suffering long-term symptoms from having had COVID infections that can last months and perhaps years. We still have people who haven't fully recovered. Beyond that, getting vaccinated protects those members of society who are not yet vaccinated or who have had COVID and may have some immunity but are not completely immune. So we still have the same reasons for getting vaccinated that we've had before. Even with rates going down, those important purposes remain. Second question, when will the EUA approval come for children ages 5 to 11 to receive vaccines? The current word is that the FDA Advisory Committee will take this issue up with the FDA at the end of October. And so we should hear word from that about the final recommendations. From there, as typically happens, there'll be a meeting of the Advisory Committee for Immunization Practices that will give further advice to the CDC, who will make the final disposition. And so I expect this to happen in the early part of November, that we'll have an answer about younger ages. Third question is, when will the Johnson & Johnson, Janssen, and Moderna vaccines get FDA approval? Still no word on when those deliberations will take place. I would be surprised if we don't have an answer to that before the end of this year, but there really has been no official word yet about a scheduled meeting date. Next, will there be booster recommendations for Moderna and Johnson & Johnson/Janssen for kids 12 to 17 for Pfizer? So 3 different questions, Moderna, Johnson & Johnson, and then the younger age group for Pfizer. For the first 2, for Moderna and Johnson & Johnson, there'll be a meeting of the FDA advisory group in the middle of October, so I think the 15th and 16th. And we expect recommendations to be made at that point. Once again, we'll look for the ACIP, the Advisory Committee on Immunization Practices, to give final comments to the CDC, allowing them to make a disposition. So I expect that to happen relatively short order. And the final question is, do I believe that masking mandates are working? The information we've had since the beginning of the pandemic is that in areas where masking is prevalent, disease transmission rates are lowered, and there are fewer cases, fewer hospitalizations, et cetera. Sometimes in areas, getting participation in masking has required masking mandates. And so in areas where the population is not inclined to do so, there is good evidence that putting mandates in place will encourage more people to wear masks and will further reduce transmission. I think there's not much debating that issue at this point. The next question is, how much longer will masking mandates need to be in place? And I think that's still an open question and will depend on how quickly the virus transmission rates in the community come down. But until that time, wearing a mask in situations where people have unknown immunization status or you're in close contact with others for prolonged periods remains a very prudent thing to do. So that concludes my comments for today. And as always, we'll look forward to talking to you again in the future. Thank you.